Welcome back to the Best PT Podcast. This is episode 22, talking about mechanical modalities. Starting with traction. Traction properties, therapeutic effects, decreased disc protrusion, pain and joint mobility, increased muscle relaxation, and soft tissue elasticity. Indications, disc herniations, joint hypomobilities, muscle guarding or spasms, nerve root impingement, osteophyte formation, subacute joint inflammation, and subacute pain. Contraindications, acute injuries, bone diseases, cardiopulmonary disease, contraindicated movement, dislocations, fractures, hernias, meningitis, osteoporosis, positive ligamentous or artery testing, pregnancy for the lumbar traction, rheumatoid arthritis, and TMJ disorders for cervical traction, and tumors. Lumbar traction. So flexion with lumbar traction allows the greatest separation of posterior structures during traction, so the intervertebral foramen. This is for patients mainly with spinal stenosis. And extension allows for the greatest separation of the anterior structures or the disc spaces, so this is primarily for patients with disc protrusions. 25% of a person's body weight is the minimal force required to overcome friction with lumbar traction, and 50% of body weight is the minimal force required to separate the vertebrae. A maximum of 30 pounds should be used for the first treatment session, and 5 to 30 minutes is the recommended treatment time. Traction can either be continuous or intermittent. So during intermittent, the force during the relax period should be 50% of the force used during the hold period. Cervical traction. The degree of cervical flexion allows targeting of regional areas of the cervical spine. So at 0 to 5 degrees of cervical flexion with traction, you can target the upper cervical spine. At 10 to 20 degrees of cervical flexion with traction, you can target the mid-cervical spine. And at 25 to 35 degrees of cervical flexion with traction, you can target the lower cervical spine. 10 pounds of force is the recommended initial treatment session dose. 7 to 10% of body weight is suggested to stretch soft tissue in the cervical spine, and 13 to 20% of body weight for joint distraction of the cervical spine. It is recommended to never exceed 30 pounds of force of traction in the cervical spine, and again, treatment time should be 5 to 30 minutes. Moving on to compression wrapping, therapeutic effects, the control of peripheral edema, management of scar formation, DVT prevention through the promotion of venous and lymphatic return, and residual limb shaping post-amputation. Indications, edema, scarring, lymphedema, new amputation, DVT risk, and stasis ulcers. Contraindications, circulation obstruction, DVT, heart failure, infection, malignancy, unstable or acute fractures, and pulmonary edema. Static compression. Two concepts here, resting pressure and working pressure. Resting pressure is produced when elastic band is stretched at rest, and working pressure is the force produced when muscles contract against an inelastic bandage. Compression bandaging offers greater pressure distally than proximally. So long stretch bandages provide the greatest resting pressure at 60 to 70 millimeters of mercury, but very little working pressure. These are great for immobile patients. Short stretch bandages provide the highest working pressure and the lowest resting pressure. So patients must have functional calf muscles and a gait pattern to benefit from these. They must be up and active. Multi-layered bandages provide moderate to high resting pressure. The multiple layers provide protection, absorption, and compression. These are used for venous stasis ulcers. And then semi-rigid bandages, also used for venous stasis ulcers. You might have heard these called as an Una boot. These provide 35 to 40 millimeters of mercury of sustained pressure. Compression garments are used to control edema, limit post-burn scars, improve venous circulation in physically active patients. 16 to 18 millimeters of mercury are used for DVT prophylaxis for those on bed rest. So if you worked in the hospital, you've probably seen these on every patient in there, called TED hose. 20 to 30 millimeters of mercury for scar control, and 30 to 40 millimeters of mercury for edema control. These garments usually last about 6 months before the elastic wears out and they need to be replaced. Intermittent compression. Intermittent pneumatic compression pump reduces chronic or post-traumatic edema, provides 30 to 80 millimeters of mercury of pressure. The pressure used here should never exceed the patient's diastolic pressure, and you can apply these for 30 minutes up to 4 hours. 4 hours are used for patients with primary lymphedema. And then continuous passive motion machine, or CPM. Therapeutic effects: decreased post-op pain, improved recovery rate, improved range of motion, reduced edema. Indications: pain, limited range of motion, edema, contractures, and stiffness. Contraindications: if the use causes pain, the patient is on specific types of anticoagulant therapy, or if unwanted bone translation is occurring. The research on CPMs is not good. Massage therapy. Therapeutic effects: reduced pain, decreased anxiety, decreased muscle atrophy, improved circulation and healing, the loosening of adhesions, reduced edema, and the removal of metabolic waste. Indications: adhesions, bursitis, decreased range of motion, edema, migraines or headache, pain, scars, and tendinitis. Contraindications: acute injuries, arteriosclerosis, cancer, cellulitis, embolus, infection, or thrombus. And then parameters. So a centrifugal force is moving from the center of the body outward, and centripetal motions are moving from the extremities towards the center of the body. The room should be 72 to 75 degrees, and no lubricants are used for friction massaging. Different techniques. Effleurage is the use of light strokes to produce reflexive responses, used at the beginning and end of massage, with strokes directed towards the patient's heart. Friction massage. Again, remember, no lubricants for friction massage. These are small circular motions over a trigger point or muscle spasm. It is a deep massage technique with the goal of reducing edema, loosening adhesions, and relieving muscle spasms. These are primarily indicated for chronic inflammation or overuse injuries. Petrissage is a kneading technique, also a deep technique performed distal to proximal, with the goal of loosening adhesions and improving lymph return. Tapotement is the use of cupping or slapping to enhance circulation, and vibration is used for relaxation. That's it for episode 22, Mechanical Modalities, and the last episode dealing with modalities. Episode 23, we'll talk about ergonomics. As always, the outline will be in the show notes. Thanks for joining.